My name's Liz and I studied a Masters of International Public Health, finished in 2009. After I did my undergraduate degree, I took a year off to travel and volunteer a bit, and I volunteered in a public health clinic in a small community in Peru, and I decided then that that's really what I wanted to be doing. 6 months later I was back in Sydney studying. Well, while I was still studying the course, I applied for a job part-time doing kind of public health policy project work. Lucky enough to be able to continue working there, and I went full-time. And I stayed there for almost a year after I finished graduating. At that point I took a position in Nepal, and I was there for a year working in a public health and nutrition NGO. I took a position with World Fish in Bangladesh. They had developed a program utilising small household ponds as a source of added income into the household. So in Bangladesh there's about 4.2 million small ponds. So basically 30% of households in rural areas have these very small ponds that range from being the size of this library to being quite small. And they're often underused in terms of what the fish that goes into them. So the project focused on rehabilitating the ponds using an improved technology, which included adding a very small fish about this big called mola, and it's very, very rich in vitamin A. The project worked at improving the pond techniques and including this addition of the fish, and then they also had a nutrition component. I constantly was surprised in all my jobs that I've ever had how much I used what I learned in the MIPH qualitative research skills that you get taught in the workshop in the first semester, quant evaluation skills, research methodologies, how to understand data, you're using that constantly, and I think that when you're studying it you probably don't realise that that's actually the most important part.